A growing number of children are facing severe illness and even death due to the flu, and experts are pointing to declining vaccination rates as a key factor. This alarming trend has left parents like Christine Ware anxious about the upcoming flu season. Christine's 4-year-old son, Beckett, is still recovering from a flu infection he contracted in January. Within a week, Beckett became extremely lethargic, unable to move his head or arms, and unable to eat or talk. This was the second time Beckett had developed acute necrotizing encephalopathy, ANE, an inflammatory brain disease caused by the flu. While Beckett eventually recovered, the process has been slow. It has taken longer for his brain to recover, Christine shared. The impact of ANE and other flu-related encephalopathies is becoming more apparent. During the 2024-25 flu season, a staggering 109 children were diagnosed with these rare complications, according to the Centers for Disease Control and Prevention, CDC. The new data reveals that 84% of children with influenza-associated encephalopathy who had their vaccination status recorded were not vaccinated. This finding is particularly concerning given the record-breaking 280 pediatric flu deaths last year, the highest number outside of the 2009-10 H1N1 pandemic. Dr. Buddy Creech, a pediatric infectious disease physician, emphasizes the unpredictability of severe flu cases. We don't always know which kids will experience the most severe forms of flu, which is why we recommend the vaccine for everyone. It's a misconception to think only sickly kids get complications from the flu. ANE is a rare condition, with only a few cases reported each year, and it has never been formally tracked. However, doctors have anecdotally noted an increase in severe brain inflammation cases among children who had the flu this year. Dr. Molly Wilson-Murphy, a pediatric neurologist and author of the CDC study, said, "Being on the ground and caring for these patients, I was certainly struck that this was an increase." The 109 children in the research were all diagnosed with influenza-associated encephalopathy, IAE, which occurs when the influenza virus attacks the child's nervous system. Symptoms can range from confusion and difficulty walking to hallucinations, abnormal movements, and seizures. Of the children with IAE, 74% were admitted to the intensive care unit, 54% required ventilator support, 55% were previously healthy, 19% died. Dr. Keith Van Haren, a pediatric neurologist and co-author of the study, emphasized, "Flu is dangerous for children, period. That is not a mischaracterization." The decline in childhood flu vaccine rates is a concerning trend. While seasonal flu shots may not prevent infections as effectively as vaccines like MMR, doctors highlight their ability to reduce the risk of severe complications and death. Last year, the flu shot was found to be up to 78% effective in keeping kids and teens with the flu out of the hospital. Approximately 90% of the 280 children who died last flu season had not received their annual flu shot. Dr. Sean O'Leary, an infectious diseases expert with the American Academy of Pediatrics, said, "The best way to protect yourself and your family from influenza is for everyone to get vaccinated." The CDC recommends that everyone aged 6 months and older receive a flu shot every year, with rare exceptions. For vulnerable children like Beckett, it is crucial for everyone to protect themselves. It's easy not to worry about it when it doesn't directly affect your family, Christine said, "But vaccination is a simple and easy way to protect my son." As we navigate the complexities of vaccine hesitancy and access to care issues, the importance of flu vaccination cannot be overstated. The lives of our children depend on it.